Hello, everybody. Welcome to the final Kaplan Meier exam. My name is Johannes Wolf. I'm a cancer researcher, and I have recorded a series of teaching videos about Kaplan Meier curves for my fellow friends in drug development and whoever else wanted to see them and study on their own time. This video is the final quiz. Find out how much of the videos got stuck. Obviously, you can challenge this exam even without watching the videos. Here are the rules of the quiz. There will be 10 questions. Please, before you start, close all the books, programs, and sources of information. Take a blank sheet of paper, write your name on the top of the page and the date today. Number the answers by the questions. You may pause the video with each question to write the answer. You may not change the answer. First question, true or false? Drawing a survival curve for a patient population where all the dates of death are known requires a Kaplan Meier estimate. You may pause the video. The answer is false. If you have all the dates of death, you have no censored data, you do not need an estimate. The Kaplan Meier mathematics is not necessary. If you do the mathematics, it will show exactly the same as if you don't. True or false? The Kaplan Meier curve drops a step down at the time of every event, but stays at the same height when observation times end censored. The magnitude of each drop depends on how many patients are in observation at the time of the event. True or false? You may pause the video. The answer is true. This is a correct description of the Kaplan Meier estimate method. You see here the original formula as they wrote it in their own paper. And you see here the way how I described that in the video. There were 10 patients as example. The first 2 patients passed away, created a step down in the curve of 10% because it is 1 out of 10. The next 2 patients were alive at the end of the observation time. Therefore, the Kaplan Meier curve did not drop. Patient number 8 passed away. This patient caused a drop in the curve, but the drop was larger than the 2 drops before because at that time, the number of patients in observation was smaller. True or false? Sir Austin Kaplan Meier, who lived 1897 to 1991, was an epidemiologist who described the Kaplan Meier survival curves and also defined the criteria to determine causality of adverse drug events. You may pause the video. The answer is false. The Kaplan Meier curve was described by 2 people, Edward Kaplan and Paul Meier, 1958. The story of the person who described the causality criteria came from Sir Austin Bradford Hill, and they're called the Bradford Hill criteria. Question 4 has 2 components. Which of these variables or columns are absolutely necessary to draw a Kaplan Meier curve? Don't pause the video yet. Which of these variables or columns are personal identifiers and cannot be in the database? Now pause the video and think. Here's the answer. The absolute necessary columns to draw a Kaplan Meier curve are the observation time, which needs to be a numeric field. And with it, there needs to be the second column that is a binary field and says if by the end of the observation time there was an event, yes or no. The personal identifiers are always anything that can identify a person. In this list, obviously the name, the date of birth, and the medical record number is also considered a personal identifier because the hospital could use that and identify the person. Question 5. Which of these software products is free with loadable packages contributed from many programmers all around the world? The answer is R. Question 6. What are the units for 10Y EFS and MEFS? You may pause the video. The answer is 10Y EFS stands for 10-year event-free survival. This is a rate. It is given in percent as a number between 0 and 100 or as a fraction in a number between 0 and 1. MEFS stands for median event-free survival, and it is a time typically given in months or in years. In the context of a Kaplan Meier curve, when you want to see the median event-free survival or median overall survival, you start at the 50% mark on the y-axis, you go to the right where it hits the curve, you go down, and then you can read the median overall survival or median event-free survival time on the x-axis. If you want to see the 10-year event-free survival or other survival rates from a certain time, you go to that certain time on the x-axis. Here it is 10 years. You go up until you hit the curve that you mean. Here it is the choroid plexus papilloma curve. You go to the left, and then you read on the y-axis, and therefore it is a rate. Question 7. Why does this Kaplan Meier curve look like a step ladder? There are multiple answer choices. A, the treatment synchronized the cancer. Relapses occurred every 3 to 4 months. B, because the statisticians had a schedule for calculating the curve. Data were gathered and cleaned every 3 to 4 months. C, the diagnostic procedures were scheduled. Metastases were detected at the same time. D, this is impossible. The curve is fake. E, none of the above. The answer is C. The diagnostic procedures were scheduled. You actually see those step downs in the event-free survival or progression-free survival curves quite often in publications, in particular in cancers that cannot be seen from the outside, such as prostate cancer in this case, or ovarian cancer. Question 8. Define PFS in the context of cancer research. Please write the answer down. The definition of PFS is progression-free survival. It's defined as the time from randomization or treatment start until tumor progression or death, whichever occurs first. True or false? Within the same patient population, the Kaplan Meier PFS cannot cross the Kaplan Meier OS curve and cannot indicate a longer median PFS than median OS. This is false. That can indeed happen, as much as it is counterintuitive and it clearly does not describe biological reality, but it is something that can happen in the Kaplan Meier curves. There is a whole video about it. And the final question: what is the typical p-value to consider the result of a Logrank test significant? Please write the number down. The answer is less than 0.05, or the mathematical sign like this, less than 0.05. And with this, we came to the end of the test. Now, the last thing is the certificate. I congratulate you. Based on your excellent results, you actually don't need to send your answer sheet in. Please go to the right lower corner of your sheet and write passed A. And then frame this, hang it up on the wall of your office. Thank you very much. Bye-bye.